Your seat commence.
Kelly O'Donnell is at the one.
Well, hello, everyone. Hello, Dr. Kathy.
Hi, Mica.
You look so beautiful.
Thank you. So do you.
It's so nice to see you.
Oh, it's good to be here. Thank you very much for the invitation.
Yes. So tonight we are going to have Dr. Kathy Iwingu. Did I say that right?
You got it.
All right. So Kathy is a board certified rheumatologist who is well versed not only in matters relating to rheumatology, but also in all things natural, which is great, which is what medicine is supposed to be about. A nice mix of the medical with the earth and the natural things, and then it makes for a nice, complete, and wholesome picture. And I love that about you, Dr. Kathy, which is why I enjoy all your talks when you talk about medicine, and then you incorporate the natural stuff in it, and that's what God wants from us to be of the earth and live from the earth. So I'm looking forward to our nice talk today on arthritis. I'm looking forward to learning a lot about arthritis, and so we are going to pray first, and then Dr. Kathy, to be all yours, and we'll try to have an interactive discussion as we go. Father in heaven, we come to you tonight to thank you for all of your mercies upon our lives. During this time of the pandemic, we know that things are really hard for a lot of people. So we ask you, Lord, to be in our beings, to be with us. We know, Lord, that a lot of people suffer from arthritis because we live here in this cold climate, and even so, older people, and there's all kinds of situations that we'll learn about. So we ask you, Lord, to be with Kathy, be with her spirit, be with her voice as she educates us on the subject of arthritis. This month is Arthritis Recognition Month, so we ask you, Lord, to please be with us as we discuss this topic. We thank you for all your mercies, and we praise you tonight. Amen.
Amen. All right. Awesome. Thank you, Mica.
Okay.
So arthritis is such a broad term. You know, folks may not realize that there are many kinds of arthritis, over 100 different types of arthritis. And so tonight we are going to talk about one type, and that's rheumatoid arthritis. So I'm going to really dive deep into what we call RA, rheumatoid arthritis, and the focus will be how to win with food. Because as you mentioned before, Mica, I love talking about how food is or medicine, but I'm going to really go into the rounded overview of rheumatoid arthritis, and I'll talk about all the drugs out there so that we can know what's available for this kind of disease.
Okay.
So, as you said, I'm a rheumatologist, and that is my specialty, arthritis, different types of arthritis. Now, what is rheumatoid arthritis? Well, the textbook definition is a chronic, systemic, autoimmune condition of unknown etiology. I'm going to break that down for our listeners because that's medical jargon. We're trained to talk like that, so nobody can understand what we're saying.
Yes.
But breaking it down, it's really a lifelong condition, something that we do not know how to cure, how to get rid of it. So it's forever as far as we understand. And it affects the entire body. Not only are your joints affected, but it can affect the eyes, the
Mhm.
heart, the lungs, really the entire system. And it's autoimmune. So it's really your body
Mhm.
fighting against yourself. It's an autoimmune process, and we don't really know exactly what causes it. We have different theories. Maybe it's hormonal, maybe it's a virus, maybe it's your genes, but we can't say for sure that we know what causes rheumatoid arthritis.
Okay.
I want to have you look at the picture of Jamie. She's a picture of a typical rheumatoid arthritis patient, a young female, 20s, 30s, 40s, and all of a sudden her joints are just in pain. And usually patients present with a lot of stiffness, a lot of pain, worse in the morning and better as the day goes on. And it
Mhm.
involves many different joints, usually on both sides of the body. So we call it symmetrical. It affects your left and your right side, and
Mhm.
it's more than one joint. So it's polyarticular. Many joints are involved. And folks tend to be really tired because it's a systemic condition, not just your joint, but your whole body is just run down and exhausted. And it most often involves the small joints of your hands and your wrists. Those are the typical areas for rheumatoid.
So, not your knees or your feet.
So rheumatoid arthritis can definitely affect your knees and your feet. It can. But most times it starts off in the small joints, your knuckles, and what we call your PIP joints, the knuckles, right, the joints right after your knuckles there. Those are
Mhm.
the most common areas involved. But it can involve your knees and your feet. The difference with the osteoarthritis, which more people have osteo than rheumatoid.
Mhm.
Osteoarthritis tends to affect usually one joint at a time. Maybe one knee is really painful,
Mhm.
or the lower back is really painful. But rheumatoid tends to affect many joints at the same time, and usually small joints. They
Okay.
can get nodules on their hands that look like these bumps here that this individual has.
Mhm.
And when I see a hand like this, I can make the diagnosis from across the room without even saying a word to the person. I know they have rheumatoid because they have those fingers that are bent to the side and their wrists are fallen. And you can see these hands and know that this is a rheumatoid arthritis patient. And that's why folks should not delay in getting care
Mhm.
because it is a destructive arthritis. It damages the joints every single day. It eats away at the bones and causes deformity.
So, Dr. Kathy, are you saying that this deformity can be avoided?
Oh, yes. Yes. The
Uh-huh.
earlier someone goes in for treatment and the sooner intervention happens, the much better their chances of avoiding hands like these. Here you see more advanced disease. This is years of inadequate treatment. Someone just figured, oh, it's just arthritis. I'm not going to do anything about it. Or they're trying to change their diet, but they're not really doing it the right way. And so the things that they're doing are not working, and the joints are constantly being damaged. So
Mhm.
it's best to go in to see a professional, see a doctor, go to your primary care first. They'll refer you to a rheumatologist and you'll get a diagnosis and a proper treatment plan. And then don't forget to include your lifestyle changes because that will really be what you need to reverse the disease. What we have, Mica, we don't know how to reverse the disease yet. We know to squash it. We can keep it
Yes.
quiet with
Yeah.
medicines. But when it comes to food, I'll tell you more about that towards the end.
Okay.
Food can reverse it. Not a
Okay.
very common known concept, but food can reverse it.
Okay.
All right. So, what's the typical course of rheumatoid arthritis? Well, um, damage occurs early. So once the joints start to feel strange, you're stiff for hours in the morning, you're having inflammation that can start to damage your joints. And you will get things like holes in your bones, the joint spaces become narrowed. And so that can happen in the first 2 years. By 10 years, half of patients, if they're not properly treated, will become disabled if they're not properly treated. And the fact is that death comes earlier to folks with rheumatoid arthritis. They do die earlier because when inflammation is unchecked, it leads to damage and death. That's why inflammation is a serious thing. We have to control inflammation. If the disease is treated, if inflammation is under control, then they are on good par with the general population. But if it's not treated, women lose 10 years of life. They die 10 years earlier from heart disease, heart attacks, strokes. The inflammation affects the vessels in the body, and that's how they die. And men lose 4 years if they have untreated rheumatoid arthritis.
Wow, I did not know this. This is very, very good.
Yeah, this goes way beyond the joints. This is not just an issue of joints. This is a systemic condition. And you're right, folks don't realize that because it's just not common knowledge. But inflammation goes all throughout the body and affects the different joints. So it really is super important to get it managed.
And I have to tell you, culturally, I grew up thinking, this is before I went into the medical field, thinking that, oh, you get old, you get arthritis as you get older. So if your knees hurt, oh, well, that's par for the course. So it's good to shed light on the fact that this doesn't have to be something that we have to suffer with because we're getting older.
Yes, 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 exactly. And I want us to keep the different types of arthritis in mind. Another time I'll come back with you and we'll talk about osteoarthritis. Osteoarthritis is the wear and tear arthritis, the kind that happens when the joints wear out. That kind of arthritis comes upon us usually in our 50s, 60s, and 70s. And it usually affects the knees, the lower back, the hips. Those things can wear out. But even that arthritis does not have to come upon us with the right lifestyle. I know some old people with awesome lifestyle who are bouncing around like
Yes, yes,
nothing is bothering them. So lifestyle is so important, Mica. I wish I had a megaphone to
yes,
tell the
lifestyle,
world
lifestyle. I love that. You talk about those lifestyle modifications all the time.
all the time, all the time. Here I'm showing you some x-rays of what it looks like inside the joint. How fast does joint damage happen? Well, on in the x-ray labeled A, this is early. In the first year or so, the person has some swelling around under the skin here in the synovium. You can see there's some puffiness here, and the bone is kind of getting a little lighter. It's not as dark as it should be. A few years later, we're beginning to lose bone. If you can see here, the bone is now almost shaved off a bit, and
Mm-hmm.
the joint space is narrowed. And if the audience can see the picture behind the x-ray behind or picture, because I can't see it, but what it shows there is a chunk of bone just missing, like a bite out of the bone.
Yeah, we
And
see.
that's an erosion. Okay, that's an erosion that happens after 2 years if the disease is not well treated. And so some key points are the sicker and the faster a rheumatoid patient presents indicates that their prognosis is worse. If you just boof, all of a sudden, all your joints swollen up, you're stiff, you can't move, and it happens really fast, your prognosis tends to be worse. Your disease will likely be worse. So you got to get into a specialist right away. Early intervention makes all the difference, all the difference. And
Mm-hmm.
it's essential to have a plan of action early in the disease. And that's not just not taking a bunch of bush. A lot of folks figure, oh, if I just drink some bush tea, everything will be all right. No, it's a lot more complicated than that. You need a diagnosis. You need to get proper care. And then with your provider, you work with them. You say, you know what, I don't really want this medicine. I want to try. They will tell you your options. You pick the best one that you're comfortable taking, and you make the right dietary changes, not just drinking bush tea. You got to do more than that. It's very important, because I see a lot of patients, Mica, who come to me and they're all bent up
Yeah,
because they waited so long to get care. And that's very sad to see.
that is. So, can you just go over how debilitating this can become, rheumatoid arthritis?
Oh, yeah, sure. So it can affect the primarily the joints in the hands. And when you have erosions in your hands, when your hands are like this, it's difficult to do everyday activities. To hold your fork and eat becomes
Mm-hmm.
difficult. To just unbutton your shirt, to
Mm-hmm.
zip up your pants is almost impossible. To put on your shoes, everyday little things literally become very difficult to do. And so you become completely dependent upon folks around you, because your fingers, your hands are not moving the way you want them to move. When the neck becomes involved, folks can't, they can't turn their head. It's difficult to drive
Yeah.
because you can't look, to see if a car is coming up beside you. So really, it affects your everyday life when you have joint damage. So you want to have those joints protected.
Okay. Thank you.
And that's just a few examples. There's so many other ways my patients suffer because of bone loss. So what about medications? Can this be treated? When folks come to see me in the office, they want a pill. That's what they're expecting, right? And yes, there are lots of pills that we have available to you. So I'll let you know what they are. We have something called NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. And these are your things like ibuprofen, Aleve, Advil, naproxen. They work fine. They help to relieve symptoms, but they do not change the disease progression. So what I mean by that is you can take a few Advils and your joints don't hurt so much anymore, but the damage is still going on. The inflammation is still there. So the erosions, the holes in the bones are still being formed. You are not treating the disease. You are just putting a Band-Aid on the symptoms. Then you have low dose prednisone. Low dose prednisone it can work better than NSAIDs. You need a prescription for that. And folks can feel really good with a little steroids, but you have to consider the long-term effects. Usually when I give my patients prednisone, the next visit they love me. They're so happy with me that they can't get enough of me. But give it a year, and when they're still on prednisone, they're like, "Doc, I'm not happy. My face is like a moon.
Yeah.
I've gained 30 pounds. They're literally angry with me now. I've gained 30 pounds. My mood is up and down.
Mm-hmm.
I have diabetes now. They've gotten all these side effects because of the steroids that I've kept them on for so long. And so steroids are a wonder drug, but they have long-term side effects. And we
Oh,
have to be aware of this. Also, the joints can be injected with steroids for acute flares. For when a joint gets really swollen, we can inject it and help to calm it down.
mm-hmm.
um, there are also things called disease-modifying anti-rheumatic drugs. These are a bit stronger. And the first one I have here is minocycline. We don't use it anymore for RA, so I'll skip over that. The ones we use more often are sulfasalazine and hydroxychloroquine, or something called Plaquenil. Plaquenil was very popular in the spotlight when Corona first hit, because that was our first go-to drug for Corona, and we've been using that for years for RA. It works fine. The cost is low. They're not expensive, but they have side effects. You have to get your eyes monitored very often. You have to get blood work done on sulfasalazine. There are side effects with these drugs. Gold is an old drug. We don't use gold anymore. That's in the past now. Other drugs are like methotrexate. That's like the bedrock drug for rheumatoid arthritis. If you have RA, you're going to be on methotrexate. And it works fairly well. I like that drug because it gives my patients relief, most of them. But the side effects are there. And
Yeah.
I tell them that all the time. You must get your blood work done because it can damage your liver, it can damage your kidneys, it can affect your lungs, it can suppress your immune system and cause infections. It's linked to higher rates of cancer. So I tell my patients, I want you to feel better. I'm going to give you a drug that's going to help you, but you have to follow up with the blood work. If you don't, I could miss the side effects and then you'll be worse off. So a wonderful drug, but not without side effects. There's also leflunomide, that's pretty much a cousin of methotrexate. And then you have the stronger drugs like etanercept, the injectables. We call them TNF alpha blockers. They work really great. I really like these drugs. They work quickly. Well, quickly means, in about 4 to 6 weeks. They work in about a month or so to make you feel well. But there are side effects. They're strong drugs. You can get infections more often, and so your doctor has to monitor you closely, and they're really, really expensive. A year supply of etanercept is about $20,000.
And covered by insurance most of the times, or no?
Covered by insurance most of the times, yes, but you want to think of it, $20,000 a year for 1 year.
It's a lot.
And we're trying to keep these patients on these drugs forever and ever. So we can see why our healthcare system is breaking down every day, because it's so expensive to maintain this kind of care. But yes, if you have good insurance, you're covered for a drug like this. But it is.
Is this a once a month injection?
So the different kinds, now we have a whole bunch of these TNF drugs. Some are once a month. This one is twice a month. And then you have some weekly ones. So the different types of injections. Now we have lots. We've gotten so many options now in the past 10 years. It's unbelievable. A lot of options.
So you're talking about a $10,000 shot?
Can you suppose you happen to miss spill it by accident? You just wasted
That's what I'm talking about.
thousands of dollars. It's terrible. It's terrible. Oh boy. So these drugs, they can be quite effective. Medicine has a lot of advancements, and I love medicine, but we have to keep in mind that they need frequent monitoring. You have to have your blood work done as scheduled, because if you don't, you could get bad side effects and miss them early. And you have to see your doctor at least every 3 to 6 months when you're taking drugs like these. So what about food in rheumatoid arthritis? Why talk about food? Well, first of all, because patients always ask. My patients always ask me, so what can I eat? Is there anything I can eat? And it's not just because it's me. I think all patients would love for their doctors to tell them what they could eat to feel better, because people kind of intuitively know that there's some connection between what they're eating and how they're feeling. So they always ask their doctor, so what should I be eating? And most times, most doctors say, eat whatever you want, just take your medication and eat whatever you want.
That's too much salt.
But when it comes to rheumatoid, though, many of us, we don't even know what to tell our patients. So we just tell them, just do whatever you want, because we don't know. Nobody tells us what to tell them with rheumatoid. So, but they always ask. So that's why I love to talk about it. And next, food is so affordable compared to these fancy schmancy drugs. They cost way less than some of these injectables. And so it's worth talking about them. And more accessible, because if you don't have insurance coverage, how are you going to afford a drug that costs $20,000 a year? It's nearly impossible for the average person. So food it's more within their reach to use food as a treatment. And so we should know more about it. And there's scientific evidence. In the field of medicine, you and I depend on objective evidence. We live for evidence, because that's what drives our recommendations and our choices. And the great news is there is evidence that food can treat rheumatoid arthritis. So before we go into specific foods, let's talk a bit about why does rheumatoid happen? What's the underlying cause? Well, it all goes back to the immune system. The immune system, we all have an immune system that God has created within us, and that's what fights bad guys. Anything that tries to attack us or negatively affect us, the immune system kicks into gear. So it usually fights things like viruses, bacteria, cancer cells, and it does this through T cells, T and B cells primarily. And in this picture, we have a very angry T cell. It's ready to fight. It's an activated T cell. And it's activated because it's been exposed to an antigen. Now, what's an antigen? Well, that's a foreigner. That's somebody that should not be there, that this T cell is going to try to annihilate, get rid of it. And we know that these antigens can enter through eyes, nose, mouth, and even through the gut. What we eat can affect our gut lining, and if it's inflamed, the gut lining can become loose, and things can traverse between the gut and the bloodstream and come in contact with a T cell, and then we have problems. So that's why we need a healthy gut lining.
So a leaky gut that they talk about.
There you go, leaky gut syndrome. Yes. Most RA patients complain of some gut issues. They're either bloated or constipated or have diarrhea. The gut is always in disarray with rheumatoid patients, and that's likely because of that gut connection with inflammation and the joint. And even in their stool, when you look at the stool of an RA patient, it's different. They have different bugs, different flora when compared to a healthy person without rheumatoid. And so there's definitely a connection with what we eat, or gut, and inflammation. Now, are there any diets in particular that are effective in rheumatoid arthritis? Well, there's science and there's literature, and I'm going to give you a few that you could certainly look up in your free time because the evidence is there. There are multiple studies that clearly show clinical and statistically significant improvement for relieving symptoms and delaying disease progression in RA. Personally, I know quite a few individuals who have turned their disease completely around by changing their diet. Now, let's talk about the different strategies to fight rheumatoid with food. One of the first ones is no food, fasting. Have you heard of this before?
Wow,
Therapeutic fasting.
yeah.
You know, fasting.
They actually have a center in Massachusetts, in Western Mass, that specializes in fasting for this, because my cousin went there for like, I don't know, a month. It's really expensive.
Yeah.
They do this. They take you through the fasting to try to help alleviate some of your arthritis symptoms.
Yes, that's called medically supervised fasting, and it really does work. You know, the Bible encourages us to fast and pray, and fasting helps us rejuvenate spiritually, and also it helps our body to almost like recalibrate, fight, clean out, fight toxins, fight inflammation. And a nice 7 to 10 day medically supervised fasting can really decrease inflammation and help rheumatoid arthritis symptoms significantly. I didn't know there was a center in Mass. I knew that they had a big center in the West Coast, but I didn't know there was one so close. So I would love to
I'll find out the info and let you know.
Yes, that would be good to know. I'd like to know where these places are. That's excellent. Now, suppose you don't want to fast. Is there any way to get rid of rheumatoid without having to give up food? Well, yes, there's partial fasting. And this pretty much includes a very light diet of vegetable juices, vegetable broth, herbal teas. And some of the examples of the juices would be like a carrot, beet, celery juice multiple times a day for about a week. and then transitioning to an all plant-based diet. Studies have done this and looked at this and followed them for over a year, and these individuals have done really well. It really fights the inflammation and reverses the disease. And when I say vegan diet here, I want to make it clear, in our circles as Adventists, when we hear of vegan, we only think of, okay, removing animal. So once it doesn't have animal products, it's okay, which means potato chips is okay, which means which means what else? There's so many things that are vegan but are unhealthy. I don't want us to consider that. When you're trying to fight rheumatoid, you have to really be serious to eat food in their natural state, not processed food. This is an unprocessed, unrefined, whole food plant-based diet. I'm a whole food WFPB person, not a vegan, a WFPB, a whole food plant-based. That's what I try to push, not necessarily vegan, because you can be a very unhealthy vegan.
That's right.
And so other studies have looked at vegan diets where the individuals only ate fruits, vegetables, grains, and nuts. They eliminated all animal products and byproducts and processed foods, and they had decreased pain and swelling. And when they checked their blood work, their ESR, their CRP dropped. Those are markers of inflammation. Those dropped. And that's linked to the inflammation in the gut being lower. So they had less inflammation in their blood overall. So that makes a big difference. What about the Mediterranean diet, huh?
I didn't see any bread over that way, Kathy.
Bread?
I saw no wheat products.
Oh, oh, you mean in the list here?
Yes, yes, yes.
Why do you love bread too, Mica?
I love bread. It's a struggle. It's a struggle.
Bread, a lot of people love bread, and bread is a whole grain. Bread comes from grain. And so what I recommend to my patients and those who are trying to have a diet that's less inflamed is to get a bread where the grain is the healthiest possible. So certainly avoid white bread, because the grain that's used for white bread is just white flour. So they've removed too much of the grain, and so it's lost its vitamins, it's lost its fiber, it's too refined. You want to stay with a whole, not a wheat bread, but a whole wheat bread. You have to have the whole in front of the wheat, not just a wheat bread. And the best bread that I recommend when you want an anti-inflammatory diet is really sprouted bread or Ezekiel bread. Ezekiel bread is really an excellent bread to have. I don't find it linked to much inflammation, and that's the one that I recommend for those who really want to eat bread.
All right. Thank you for that.
Yeah, sure. So what about a Mediterranean diet? Folks want to hear about this diet a lot because they get to still eat fish, and they get to still get to maybe have a little bit of wine. Isn't wine good for you? So there are lots of studies on the Mediterranean diet and rheumatoid arthritis, and they have shown to have improvement as well. And that's because the processed foods are removed. I think the processed foods are really worse than the meat. So if somebody wanted to leave a little bit of fish in their diet, but remove all the processed food, they do far better than somebody who left processed food in their diet. But I do believe that if you removed all inflammatory foods, including fish, you'll get to your desired outcome faster. The Mediterranean diet works because it's high in omega-3 fatty acids, which are really anti-inflammatory. They have unrefined carbohydrates, no crackers, no biscuit, no cookie, no donuts, none of that stuff, and a lot of phytochemicals from green vegetables. And food is just so powerful in many ways, and I'll go through a few reasons why. Women who breastfeed have been shown kids who have been breastfed have a decreased lifetime risk of rheumatoid arthritis overall. So it kind of sets them up to do better with their immune system long term. Olive oil, has been really touted as one of the healthiest oils available to us, and this decreases cytokines. Dried plums, or what we call prunes, helps decrease tumor necrosis factor alpha, and that's what some of these expensive drugs are trying to do. TNF alpha inhibitors. Dry prunes do the same thing, dried plums. Soybeans have genistein, an important isoflavone and anti-inflammatory. It inhibits interferon gamma. We have drugs to inhibit interferon gamma. Soybeans can do that as well. Food does what drugs do. Pineapples are high in bromelain in the seeds and the stem, and this really helps with arthritis. Ginger, excellent for arthritis. If you have arthritis, you need to be having ginger in your diet. Grate it in your salad, put it in your soups, make tea out of it. Very good to fight inflammation. Turmeric has curcumin in there, and that inhibits interleukin 1 and interleukin 6. These are known to be mediators of inflammation. So turmeric inhibits those byproducts and helps decrease pain and swelling. About 500 milligrams 2 to 4 times a day in capsule form should be fine. Or you can buy it now in the store, the root in the store, and cook with it. It does stain your hands though. I've bought it because I like to go as natural as possible. But whenever I try to grate that thing or cook it, I end up with yellow fingers all the time. So it was really potent, but it works great. Omega-3 fatty acids, excellent to fight inflammation. And foods that have that include walnuts, flax seeds, and chia seeds. You want to have these foods in your house and eat them every day. I grind flax seeds and put it in my smoothies, on my salads, put it over the porridge. It really does well to fight inflammation.
Of this slide, Dr. Kathy, I'll go back to that slide before. Do chia seeds have a short shelf life?
Many of these seeds and nuts will become rancid if left in your cupboards for months. So they have to be refrigerated or frozen.
Okay.
I buy all these things in bulk, and so I have to put them in the refrigerator because if I don't, they will spoil and become rancid.
Okay.
Yeah, so for them to be cheaper, I get them in bulk, but I have to put them in the refrigerator. So that's a good question. What about pre and probiotics? Those are very useful in rheumatoid arthritis because we're talking again about the gut. The gut many times is inflamed, and that's where things pass over into the bloodstream. Food, though, can be a prebiotic. A probiotic is a good bacteria that helps in the GI tract. A prebiotic feeds those good bacteria. And so foods like yams, onions, garlic, those are prebiotics. And you want to eat lots of those things. Those help to feed the good guts, the good bacteria in your gut.
Right.
Herbs that are good for rheumatoid include things like boswellia, cat's claw, and aloe vera. They're very good for rheumatoid, and I've seen studies that have shown that they can be useful in this condition. And so what's a good prescription for rheumatoid arthritis when it comes to food? Well, first of all, if you have arthritis, you want to remove refined sugar. That's the first one I tell my patients. Remove refined sugar.
That is
So,
no bread.
well, the refined sugar you would have in your soda. That's the white sugar you add to your tea. That's the sugar that makes the donuts so sweet. That the refined sugar in the cookies, the ice cream. Ice cream tastes great because it has so much sugar in there. you
Right.
know,
Right.
that's what you want to remove first. That really affects the inflammation level. And then you want to remove the dairy products because they also are very inflammatory. And so milk and cheese don't work well when you have inflammation in your joints. And then the meat. You want to remove that also. You not only want to remove those, but you want to increase your fruits and vegetables significantly because you want to remove the bad and then you want to bring in the medicine. The medicine is the fruits, the vegetables. Eat lots of bananas, peaches, apples. Eat fruits in season, especially. You want to increase your vegetables, your spinach, your kale, your broccoli, your tomatoes. Eat a lot of those things. That's what's going to help bring the inflammation down.
I
In,
have, I do have
mhm.
a question about the slide that you had with the, you talked about eggplant, and talk to me a little bit about the nightshades, because I've heard about the nightshades causing inflammation.
Yes. Yes, yes, yes. Okay. The nightshades, so we don't have a lot of evidence to say that every rheumatoid patient does badly with nightshades, but some individuals do worse with them. So I tell those patients to first of all, remove all of them from your diet. The tomatoes, the eggplant, the potatoes, the sweet peppers, remove those, and then introduce them one by one. You may find that one may do badly in you, or maybe two, but I don't think they all would do badly in you.
Okay.
But we don't have enough evidence to say you should remove them all forever. But bring them in one by one.
Okay.
That's what I would say with that. All right. So not only do you want to increase your fruits, increase your vegetables, but then you need to have things like your beans and your peas for more fiber and protein. And you want to stick with whole grains. Whole grains help you to be full so that you won't want to snack all the time because they have a lot more fiber. Whole grains are things like I have whole wheat here, brown rice, oats, rye, millet, and corn. These are rich in antioxidants, vitamin E, and other minerals that really help with arthritis. So daily supplement, people love taking supplements. They want to take some pill to feel like they're really treating something. So I tell them, yes, that's fine. Take the vitamin D. Vitamin D is very helpful with the all the cells of the every cell in your body has a vitamin D receptor. So it is vital to have a good vitamin D level for proper functioning of your bodily functions overall. It helps with inflammation as well. And you want to take omega-3 fatty acids. That's very good. It decreases inflammation and helps with arthritis. What about probiotics? If you want, you can take a probiotic. I'm not an expert in probiotic pills to say take this or that one, but I do know that many foods can function as pre and probiotics. So that's what I advise to take. A lot of garlic, a lot of onions, and then your fermented foods have your probiotics in there. And I love to give recipes. And so I'll end with this recipe, Mica. I call it golden milk.
Yes.
It tastes awesome. It helps to fight inflammation, and you can drink it when you're relaxing or when you think of a flare, and it's very soothing. I use 2 cups of milk. Now, of
Okay.
course, the milk I use is not cow's milk, right? By now, you know that I'm not not a cow's milk person. A plant milk, so soy milk, almond milk, rice milk, oat milk, any of those. 2 cups of
Pea
milk,
milk. Pea milk.
pea milk.
Have you had pea milk?
No, have you?
Yes, it's really good.
Really? Okay, awesome,
From
awesome.
peas. Yeah, it's really good. Whole Foods.
Okay, okay, nice, nice. To that milk, you can add a sweetener, 2 tablespoons maple syrup. Now, please keep in mind that when you're using sweeteners, you really want to use liquid sweeteners. That when you're moving into a more unprocessed diet, you want to sweeten with dried fruit, and liquid sweeteners. So that's why I have maple syrup here, and I don't have brown sugar or white sugar. Um, a teaspoon of ground turmeric, that's the anti-inflammatory right there. A half a teaspoon of ground cinnamon, a half a teaspoon of vanilla for the flavor, and a quarter teaspoon of ground ginger, anti-inflammatory. Now, When you mix this up in your blender or you put it in your pot and make it a nice warm drink, it tastes like a latte from Dunkin' Donuts. And you're not, it tastes really good. And you're not getting any inflammation in there. You're not getting any fat. You're not getting any chemicals, any preservatives, just food that heals. And really, Mika, I can't stress enough how much food can taste good and make you feel good every single day of your life.
Yeah.
So I'll end I'll end with that and take any questions.
So there is one question. Angela Jackson has a question. Angela, can you ask Dr. Kathy your question if you unmute? I believe her question was about the nightshades. But if you could just, she said that I think she said, let me see in the chat. She said someone told her to stay away from peppers, and so I think maybe you should just clarify with people what is a nightshade.
Yeah, sure, sure. So that's a group of foods that has been linked based on patient observations with worsening joint pain. And those foods are white potato, um, eggplant, tomatoes, bell peppers. And so usually when you have arthritis, folks say, don't eat that. But the problem is they tell you don't eat that, but they don't tell you really what should you do to fight the disease. Just doing that alone is not going to cure your inflammation. That's hardly the reason why your whole body is going, out of whack. So you want to follow the prescription I gave you earlier to fight rheumatoid,
Mhm.
remove the guys that are known to trigger inflammation, overwhelm your body with the foods that fight inflammation. And while you're doing that, you can remove the nightshades in case you have a reaction to them. But when you go to a whole food plant based diet, you're more than likely be able to eat those things without a lot of problems. So that's my recommendations on that.
All right. Thank you for clarifying that. So this was very helpful. I am going to use oat milk tonight and I'm going to make that drink. I have some ginger. That'll be my dinner. I'm not going to have dinner. That's going to be my dinner.
Okay.
I took a picture of the recipe and I have it. And I'm going to try not to eat a slice of whole wheat bread and
No,
peanut butter with it.
no,
Because
no,
it
no, no,
sounds
no, no,
like
no, no. Don't do
it
that.
sounds like something that should go with a slice of toast and peanut butter, but we're going to avoid that tonight.
Not
Okay.
tonight. Not tonight.
The drink.
Oh my goodness.
So I want to say thank you to you, Dr. Kathy, for all this helpful information about how to move through this, not only with medications, but through the natural medicines that God gave us in plants. So
Yes.
that's always a lot of wisdom. For those of you who don't know, Dr. Kathy speaks on Mondays and Wednesdays after Pastor does my prayer today. Dr. Kathy comes on and she gives us life advice about how to eat better and to not only about medical things, but how we can incorporate our diet to help us with the medical problems that we may have. So Dr. Kathy does that on Mondays and Wednesdays, and then we do the doctors in every other Sunday to keep everyone abreast of all things. And every month we're going to try to focus on the things that are pertinent for the month. So every month they talk about a certain, like this month is heart cardiovascular heart health month, and also arthritis. This is why I asked if you could move that along for us. I actually, it might be a little later, but I moved it along because you had availability. And arthritis color is blue. This is why I'm wearing blue today. So I want to thank my friend Flo, who's joining us from Virginia. I want to thank my friend Angela Jackson, who's joining us from New Jersey. I want to thank all my family members who are listening online, and they do this every Sunday. Thank you for your support. And I want to thank everyone who has joined us today to come and learn and gain some wisdom. And so we want to invite you to join us as often as you can, because it's not, a lot of churches or ministries don't have this opportunity to have medical professionals in the midst to bring to light all the um, all the diseases and all the interventions. So we're very blessed at Hope that we have that in you, Dr. Kathy, in my husband, Dr. Martin, and in all the other people who join us as guests and all the other doctors in our community to come and do this with us. So we look forward to having you come again and again anytime you want to. Anytime, no pressure. Thank you very much for that. So
Sure, Mica.
with that being said, I don't see any other questions. Someone says, "Oh, Flo from my sister and friend Flo says thank you. That was very informative." And so thank you again, Dr. Kathy.
Sure, Mika. And I
So
also want to say I created a website just so that I can help folks to learn more about how to move from a processed diet to an unprocessed lifestyle. And so that recipe I gave there with the golden milk is on the website and other blogs that help give insight on a whole food plant-based lifestyle is there. And so I'll share that with you so that folks can maybe find some interesting information um, from time to time. It's Wellness MD Mom, uh, www.wellnessmdmom.com. And that's where you can also find more information that I have to share.
yes, and I've been on the site. It's very well done, and there's a lot of information on the site. I myself had some aches and pains, and I had to make some dietary changes. Um,
Good.
and I did speak to your staff about it, Dr. Kathy. So thank you so much for all you do. And thank you, everyone, for joining us today. So we'll just pray and give God thanks before we go. Father in heaven, we want to thank you for your mercies. We thank you for every single listener. We thank you for my mama who lives in Fitchburg, Mass, who's on listening with us. We thank you for all our friends. We thank you for all the people who are listening for the first time. We thank you for the ones who listen all the time, like Nyclaw Shaw and everyone else who's listening. We thank you for our pastor for encouraging us to continue with this ministry online. And we ask you, Lord, to continue to bless him and to give him strength to continue to push us forward. We thank you for Dr. Kathy tonight. We ask you, Lord, to be with us and to help us to go through the week, remembering all that we have learned and going one day at a time and making the changes that are necessary to keep us healthy and whole as you would have us. We thank you, Lord, for everything that you've done for us. And in your Father's name, we pray. Amen.
Amen.
All right. Thank you, everyone. And we will see you again in 2 weeks. We will discuss heart attacks, strokes in 2 weeks.
All right. Sounds
All
good.
right. Bye bye, everyone.
Bye.